The basic difference between the referral letter and the discharge letter start from the second paragraph of body. Hello everyone, good morning, assalamu alaikum. I am Dr. Faraz Ahmed and today we will discuss in detail how to write a discharge letter. What is the template of the discharge letter? So before going to the video, we will definitely thanks to Dr. Usman Haider Lee on his continuous support in making all these videos and this valuable material. Thank you. So let's move to the video. So as I told you, we are going to discuss about the discharge letter writing. In this video we will discuss about the writing tips of discharge letter, details of discharge letter, and there we will also discuss about the letter template. Okay, almost the same as we discussed in the previous video. That is, there will be a 45-minute writing subtest, 5 minutes to read the task and 40 minutes to answer that task. You should have to use 2B pencil, so if you commit a mistake you can easily erase it. A letter should be 182 should be between 180 to 200 words, and use of the template to write a letter, this is very important. While you use a template, you always focus, you always remain on point. Once you are out of the template, you get lost. So always try to use the template. Always practice in the official answer sheet, so on exam day you feel easy while you're writing your letter. Try to finish your letter in just 35 minutes, so in rest of 5 minutes you can look for your mistakes. Read the corrected letters. So guys, this is very important while you are practicing your exam. Read corrected letters from benchmark, from futureland, from shows, any website you want. So read the corrected letters so that you could know about your mistakes. Always use long templates for short case notes and short templates for long case notes. We will shortly discuss about the templates. So this is very important point. Include only relevant data. Exclude irrelevant data. So don't include irrelevant data. This is very important. You are marked on basis of almost this criteria. Always leave a line between the paragraphs. This is very important. Any paragraph should contain more than 2 sentences. You can also write a 1 sentence in intro paragraph, but it's good to write at least 2 paragraphs. Avoid very long sentences. This is very important. When you use very long sentences, there are very high chances of mistakes. So avoid long sentences. Use of punctuations is very important. You should learn about the rules of punctuation use. Use singular and plural form. Make sure that you use articles as well. So guys, this is very important point. In every paragraph you should mention patient name once. Don't use pronoun. Don't start any paragraph with pronoun. You start paragraph with name of the patient and then you can use pronoun. So as in the last slide, we have already discussed about the types of letter. In this slide, in this video, we will only discuss about discharge letter. So let's move to the discharge letter now. Discharge letter format. This is very important slide, and we are going to our task today, which is discharge letter format. So we will start same as referral letter. Start with address, then we will add introductory paragraph, then we will add body paragraph number 1, body paragraph number 2, body paragraph number 3, then conclusion and salutation. So here is the difference. In body paragraph, social, after introduction, in body paragraph number 1 you will include social, family history, past medical history and allergic history. This is same as referral letter. The difference start from the second paragraph of the body. Now here what you will do: hospitalization including the treatment, any procedure, recovery status or complications. Okay, you will include everything, including diagnosis, treatment, if you have done any operation, any procedure, what is recovery status of the patient, and the complication if the patient has developed, and you will include in this paragraph, second paragraph. All strategies of the patient, all stages of the patient during the stay in the hospital will be included in body paragraph number 2. So in third paragraph you will include current condition of the patient during admission to the hospital, and what is your plan of discharge, you will mention in body paragraph. So then you will include all your in conclusion in this paragraph. At the end you will mention salutation. So let's discuss all these stages in detail. Okay, now address, you already know. We will start with date, that is 25th March 2020. Then you will write the doctor name, Dr. Faraz Ahmad, endocrinologist, DHQ Hospital, Miawali. Okay, if doctor name isn't given, you can write admitting officer, endocrinologist, DHQ Hospital, Miawali. Then you will leave a space here, look here, space here. Then you will start dear Dr. Ahmad. Don't write DOCTOR, write like this, DR. Dear Dr. Ahmad, you will put comma here. If doctor name isn't given, you will you have to write admitting officer in start, and you will write here dear sir and madam. Okay, then you will go to the reference. Remember one thing more, leave a space here also. Okay, then you will write reference of patient, reference Mr. Barry Jones, date of birth like this. You can write reference in 3 ways. One way is this, you can put a comma here and you can write date of birth in the same line. Second method, Mr. Barry Jones, move to the next line and write like this. Okay, there is third method as well. You can write reference Mr. Barry Jones, comma, aged 27 years, aged 50 years, 10 years, 12 years. You can write reference in this way. Okay, let's move forward. So discharge letter format, what will you write in introductory paragraph? Well, what you will write in introduction. Okay, so you will start like I am writing to update you. In referral letter you were writing I am writing to refer. Okay, here you will write I am writing to update you regarding Mr. Jones, a 27-year-old student who is being discharged today. Okay, or who is to be discharged today after laparoscopic appendectomy, after recovery from MI, being recovered from MI, after recovery from DKA, anything you can put here regarding your case notes. So you will put at the end, now she is better, she is fine, she is improved and needs future care. You can write like this. An introductory paragraph you have to mention I am writing to update patient details. Okay, who is being discharged, when, you have to mention the time of discharge, when you are going to discharge him. You are going to discharge him today, you have to mention this, who is to be discharged today. Okay, you will also mention that after a laparoscopic appendectomy, you will also mention any procedure, any diagnosis, any illness here. Okay, you can also write like I am writing this letter to update you regarding Mr. Jones, 27-year-old student who was diagnosed with MI. Okay, for follow-up treatment and future care. Okay, you will have to mention all this. Okay, you can also write introductory paragraph in this way too. I am writing to request future care of Mr. Jones. Okay, what is your purpose? Future care of Jones, a 25-year-old student who underwent treatment for the suspected pneumonia, who underwent treatment for suspected MI. He was admitted following an episode of vomiting along with chest pain and is being discharged today. Okay, in introductory paragraph you will mention a brief patient history, brief patient detail, like what was the diagnosis and what is you are going to when you are going to discharge him. So you will mention these to in introductory paragraph. So don't forget to mention, I am writing to update you, okay, who is being discharged today, when you are going to discharge him today. So these things should be kept in mind while you are writing a discharge letter. Okay, keep in mind discharge letter is much easier than the referral letter, so don't be panic. Okay, let's move to the next to the body of letter. So we divide body of letter in 3 paragraphs. In very first paragraph, body 1, we will mention social, family, past medical history and allergic history, similar to referral letter. Okay, we can write like Mr. Jones is single, she has had heart problems since 2005, for which she takes beta blockers. His family history is positive for asthma, diabetes. Please note he is allergic to penicillin. Okay, you can also write like this: Mr. Jones is single regarding or in terms of his medical history, he suffers from you can write anything, MI, asthma, for which he has been taking. Okay, please note he is allergic to, like this. Okay, you can also write like this: Mr. Jones is widowed man and has 2 children. He has a medical history of anything, you can write, and please note he is allergic to penicillin or any other medication. Okay, you can also write like this: Mr. Jones is single, his past medical history is unremarkable apart from what? Apart from diabetes, hypertension, anything you can put here what your case note is saying you. Okay, which has been managed accordingly. Please note he is allergic to penicillin or anything, any drug. Mr. Jones is married and has 3 children. His medical record revealed that he has a long history of dash, for which he has been taking dash medication. It is worth mentioning that he is allergic to penicillin. Okay, so here I would like to say something. If you have small case notes, use long template. This is long template. Okay, if you have long case notes, use short template. So this is short template. You can see here that there are 3 lines and there are more than 4 or 5 lines here. So use long template when you have short case note, use short template when you have long case notes. Okay, let's move forward. So guys, the basic difference between the referral letter and the discharge letter start from the second paragraph of body 2. In this paragraph you mention the complete hospitalization of the patient, which include hospitalization including presenting complaint. What was the presenting complaint when patient presented to the hospital? Diagnosis, treatment given to the patient, any procedure if you have done with patient, or what is the recovery status, and have patient develop any complication. So all these things you will write in body 2 paragraph of discharge letter. Let me repeat once more. Presenting complaint, you will mention presenting complaint, diagnosis, treatment, any procedure if you have done, or recovery status or complication. So in short, all stages during the stay in hospital and patient progress you will have to mention in body 2 paragraph. So how you will write this paragraph? Let me discuss the template of this paragraph. You will write like, on 14th March 2020 Mr. Jones presented with dash complaints. On examination, dash was noticed and therefore or consequently relevant investigations were ordered, and he was commenced on Calamox, Solocortif or any other medication. Okay, you will write presented with presenting complaint, examination, or what you did like this, relevant investigation, you sent relevant investigation, and what treatment you give him, commenced on Calamox or Solocortif. So you will write everything here including presenting complaint, treatment given, recovery status, any complication, all these. Okay, let's move forward. Then you will write the test results. The test results indicate what elevated white blood cells count and decrease hemoglobin. Anything what your case note tell you, you can write here. Therefore, consequently, dash was instituted or started or planned. Consequently, laparoscopic appendectomy, laparoscopic cholecystectomy was planned. You can write like this, or consequently, some other medication like ceftriaxone or dexamethasone was instituted or started. So keep in mind these templates and put the information from your case notes. Okay guys, let's move forward. So in body 3, third paragraph of the body of letter, what you will write: current condition and discharge plan. So you have done everything during the hospitalization in paragraph 2. So in body paragraph 3 you will write what is the current condition of the patient after your treatment, after your procedure, after your operation. What is current condition of patient, and what is what you are planning for patient. Okay, in this paragraph we can write like Mr. Jones' symptoms have improved and he is being discharged. Okay, his current condition, has it improved or not. Like we can write have improved, symptoms have improved and he is being discharged today, or he is to be discharged today. Okay, this you will write in paragraph 3. So let's move to the next paragraph. This is conclusive paragraph. This is same as the referral letter. So what was the difference between discharge and referral letter? Only difference exists in body paragraph. Okay, so conclusion you can write in the same way. In light of the above, it would be greatly appreciated if you could see this patient, or if you could see Mr. John and manage him accordingly, or manage his condition accordingly. Okay, you can write all this. Should there be any queries, please do not hesitate to contact me. Keep in mind these words are not counted in word count. Okay, let's move forward. At the end you will mention the salutation, yours sincerely. If doctor's name was given in the start, then you will definitely write yours sincerely. Keep in mind Y should always be capital and sincerely S should always be a small letter. Okay, you will leave a space here. Doctor, don't forget to put a full stop here. If you start the letter with dear sir or the madam, then you will definitely put yours faithfully space and doctor. So guys, this was all about the discharge letter, the format of the discharge letter. So please try to follow these formats so you can easily write your discharge or referral letter without any mistakes. Once you learn the format, you can easily write any letter, either it's a discharge letter or a referral letter. So guys, remember me in your prayers and prepare well for your test. Good luck to you all. Thank you. Bye bye. Allah Hafiz.